Thanks for staying with us. As we've discussed, antibiotics are strong medicines, but they don't cure everything. And when they're not used correctly, they can actually do harm to your health and to the health of people around you. You play an important role in your own patient safety, and helping fight antibiotic resistance can help keep you from getting a superbug. So how do you protect yourself and your loved ones? Heidi has stuck around with us, and Dr. Skillman is back. Thanks again for being here today. So Dr. Skillman, let's start with you. When somebody gets sick, what they're most concerned about is just feeling better as soon as they possibly can. We now know that antibiotics only work with with bacteria, not with viruses. So if someone does have a virus, what can they do to feel better?
There's a lot of products you can purchase in any good pharmacy that can help you feel better. Some decongestants, things like acetaminophen to reduce the fever and the general body aches. We know that gargling with salt water can help a sore throat a lot. And there's even some good scientific studies that show honey in a cup of tea can reduce coughing and make your throat feel a lot better.
Okay, and how does somebody know if they're sick with a bacteria or with a virus?
That can be quite difficult, actually. They both can cause fevers. They can both make you feel miserable and give you pain in various locations. Usually a bacterial infection will cause pus or some kind of ugly fluid. If it's in the skin or in your lungs, you may be coughing up more ugly junk than a virus would produce. But it can often be quite difficult to tell the difference between them.
Okay, and if I find out that I am sick with a bacterial infection, then if I get an antibiotic, how can I be a good steward of that prescription?
You can talk to the doc who prescribes it to you, or the health provider. Often it's not a doctor, and just ask them if it is exactly the right antibiotic and not one that's unnecessarily broad. You don't need to kill all the bacteria in your body, for example, just the ones in your throat if possible. You can ask about side effects of the antibiotic. You can ask about interactions with your other medications, maybe with alcohol if you drink on a regular basis, things like that. You want to take the entire prescription that the doctor or the health provider prescribed. Don't stop too soon. And don't treat yourself. Don't go to your medicine cabinet and find something left over from a previous illness. And when you shouldn't have any left over if they were prescribed correctly. But if you are at the end of your 7 or 10 days of therapy and you have a few pills left, you should discard of those carefully in the solid garbage. Don't put them in the water supply.
Okay. And dentists sometimes prescribe antibiotics as well. Are there things we should know if a dentist is doing the prescription versus a doctor?
Very similar things, actually. Sometimes dentists will have insight on some solutions that you can gargle with or rinse your mouth that can eradicate infections that involve the teeth or the mouth. But dentists are awful bright people in general, and they do a pretty good job with antibiotics.
Okay. And in addition to just being good stewards of antibiotics when we do get those prescriptions, how can people just avoid getting an antibiotic-resistant illness or infection in the first place?
You can avoid the resistant infections the same way you avoid all infections. The main thing is to wash your hands. Do that carefully with soap and water or one of these hand gels that come in little bottles, or you find them stuck on the walls of healthcare facilities. Those don't work as well as a good 20-second hand wash with soap and water. The soap is the key component. The water doesn't have to be warm or hot, just some good soap on your hands and around the fingernails and knuckles. You want to ask your visitors that may come to see you in the hospital to wash their hands before they enter the room and touch you and before they leave the room, because we don't want them carrying your germs around the hospital and around town. If you go to public places where there's handrails and doorknobs, wash your hands now and then before you have lunch, for example. That's the real common way to put bacteria into your body, is through eating something or touching your mouth after you've got it on your fingers without any knowledge of it. You won't see the germs on your hands, but you'll scratch your eye or pick up your tooth or fingernail and get a bacteria that way.
And you mentioned washing your hands if you're visiting somebody in the hospital. And we know that the hospital can be a source for these antibiotic-resistant bacteria, and they become what's known as healthcare-associated infections.
That's right.
Can you talk a little bit about how to keep people safe from those kind of infections when you're in the hospital?
We use isolation procedures for people when they have a recognized highly resistant bacteria, or a virus for that matter, where they're in a room that the visitors must wear gowns and gloves and sometimes masks to go in the room. Occasionally we have trouble getting the visitors to cooperate with that, and we have to become stern with them. ideally, not just the nurses and docs and physical therapists would gown and glove that way, but all the visitors would. That's the best way to prevent carrying those resistant organisms out of the patient's room and into the hospital, and the elevator buttons and every doorknob between the room and the outside world. So we ask our visitors to be good stewards of hand hygiene.
And if I were going in for a surgery, for example, and I know I'm going to be prescribed an antibiotic, what should I do to help stay as healthy as I can for that sort of situation?
If it's a planned surgery, something that's not emergent, we have to remember that infections don't just occur in the operating room or the hospital, but it's the several days before the procedure and the several days after. It's a full spectrum of opportunity to get an infection. So you take care of yourself before you come to the hospital with careful bathing, maybe sleep in clean sheets on a clean pillowcase the night before surgery, wash your whole body carefully with good soap. The medical team will do their job while you're in the hospital, but after you leave the hospital, if you've had surgery especially, don't let your cat walk on yourself or your dog lick your bandages or your parakeet sit on your shoulder that was just replaced, things like that. We see things like that occasionally, and it's disturbing, but it's real. So
Okay.
keep the wounds clean after surgery.
Okay. And we've given out a lot of information. Heidi, if anybody has any questions or if there's more that they would like to know, are there resources they can go to just really quickly?
Absolutely. The CDC has put out some great recommendations for patients, and that can be found as part of their Get Smart campaign. So if you just go to their main webpage, there's a lot on antimicrobial resistance, but there's just a lot of patient education pamphlets and tidbits that would be helpful for people.
Perfect. Great. Thank you so much for all your information. And thank you to Tom, too, for being here. And thank you for watching. That's all we have for today. We hope you'll be able to do your part to fight antibiotic-resistant superbugs, and most importantly, that you will stay fit, stay well, and stay healthy for life with Healthy Living for Life. Until next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.